Welcome back everyone to Showbiz India, and it is time for our special sponsored segment by the LA County Department of Mental Health. And with us I have Dr. Neelofer Tayyib. Welcome once again. It's great to see you.
Thank you. Great to be back.
We talked the last few times about how mental health issues does exist in the Indian and Desi community. But what are some of the reasons that they don't reach out for help?
Some of the major reasons people don't ask for help, whether actually it's across cultures, races, ethnicities, is a lot about shame and stigma. So a lot of people, especially when it comes to mental health and emotional issues, tend to feel their first instinct is that they've done something wrong, that it's their fault, something must be wrong with them. So they tend to not take it seriously and feel a lot of shame and keep it quiet. Unlike any other medical condition where you would go to a doctor for diabetes or hypertension, a lot of people, because of that shame and stigma, don't talk about it. There's also, lack of information or, the wrong information out there about emotional and mental health issues, which is why we're here to help clear some of those up, and as well as some cultural factors as well that kind of tie in.
So what are some of the cultural factors that tie in?
As a Desi community, we very much value family and community harmony. It's a huge strength. It's why we're all very connected, why we love your show, because we like watching and hearing about our culture. On the other hand, there can be some people who can feel pressure to appear as happy and normal and successful, sometimes not even as much for themselves, but for the reputation and status of their families. When they start experiencing mental health symptoms or emotional struggles like depression or anxiety, they worry. They worry about being called crazy or lazy or stupid. Again, not so much for themselves, but more so about their family's reputation. So then you start this cycle of silence, which is really the most dangerous thing when it comes to mental health issues. And I think it's important for people to remember that those that love you would never want you to suffer in silence. So another reason that people tend to not seek mental health services in the Desi community has to do with our culture being very goal-oriented, valuing resilience and strength is a really positive factor. But what sometimes can happen, especially when people are experiencing pain, whether it's emotional or physical, they tend to hide it because they don't want to be seen as weak. So there's a flip side to it. A lot of times when people are experiencing these issues, they'll try to focus and distract themselves on work or school, which is kind of counterproductive, unfortunately. Mental health issues, just like a lot of health conditions, if you ignore it, it only gets worse. And so it starts this really dark cycle, really, of people starting to feel frustrated, feel stuck, and then they start feeling guilty and feeling like a failure. So we want to do whatever we can to avoid that dark place and let people know that there's always hope. And the third reason is that a lot of people believe that they are experiencing these emotional and mental pain and suffering because of something they've done, whether it's in this life or a past life. And this is a really hard one to tackle because already, because of the stress and pain they're feeling shame and guilt. So it makes those messages really powerful. And so what we really encourage is for people who are experiencing that type of pain to really find places and people that give them hope and faith in that there will be a better future, whether that's their family or friends or their faith community, whether it's a temple, a gurdwara, or a mosque. Someone that will be supportive and help them from getting to that dark place. The final and most common belief that's out there that keeps people from getting services is the belief that mental health illnesses are genetic and somehow incurable. The fact is that yes, some of mental health symptoms are genetic and they are passed on, but it's not true that they're not treatable and sometimes even curable. Science has come a long way. Each person is unique and each case is unique and really deserves its own attention. So, essentially all these messages are out there. I just mentioned a few, and we're hoping through, efforts like this one that we can start to really bring more facts and realities around mental health issues, which is that anybody can have experienced them and it's nobody's fault, and therefore it's nothing to be ashamed of, and there's no shame in asking for help, just like you would for any other condition.
Wow, these are very valuable insights. Thank you so much, Dr. Neena. And what number can people call if they feel like either they or loved one needs help?
Sure, they can call the Los Angeles County Department of Mental Health helpline at 1-800-854-7771. Our operators are available 24 hours a day, 7 days a week, and they speak Hindi, English, or whatever language you need. They have interpreters available. Your call is safe and confidential. I feel like that's really important for people to know. In general, our services are available for those who are residents of LA County, including those who are uninsured or undocumented.
Thank you so much, and we'll see you next week.
Thank you.